Hi, everybody. Zach Shifflett here, Director of Business Solutions at Premier Virtual. I wanted to thank you all for taking the time to join us yesterday on our Healthcare Hiring Trends webinar. For those of you who are unable to join us, you can find the replay attached here. Covered a lot of great topics with myself, our Director of Marketing, John Garcia, as well as Ms. Kenietha Presnell with Churchstreeter and Crosse. Thank you all again. Look forward to seeing you again on future webinars, and let me know if you have any questions. That really leads me to my first point, which was talking about sort of what kicked off the staffing crisis in healthcare. I think you really touched on it. Obviously, we all know what happened in 2020 with the COVID-19 pandemic. Now, were you seeing any staffing problems before COVID, or do you think COVID was the real catalyst for the problems that we're facing today?
I think some of it was based on geographic. So certain areas were probably starting to feel it in, the late 2018, 2019. And then obviously 2020 really hit healthcare hard for a variety of reasons, right? So you had we had to do layoffs in a lot of healthcare systems, and people that were either furloughed or laid off from their position, maybe they didn't come back. You had a lot of clinicians that went to travel-based companies and said, hey, I can earn some big bucks doing that, and I'm going to do that because I can. And then you had this population of people that probably had maybe 5 more years in the workforce that said, is it really worth it? What's important to me at this point and this stage in my life? And so they retired early. So we were starting to see that downhill slide a little bit, but I think the pandemic in 2020 really kickstarted it. And just for reference, I was reading an article last week that projected between now and 2026, it's estimated that another 6.5 million people are looking to leave the healthcare sector.
Wow.
And when you think about that, there's only, and I know we're going to talk about this later, 2 million people projected to enter the healthcare workforce. So that leaves a pretty significant gap.
Absolutely. That is a very significant gap. We're talking about multiple millions of people, and we're already struggling, right? Those of you who are on this call, you already know the pain points of recruiting into healthcare right now. They're already at your doorstep. So you can imagine things aren't necessarily going to get better. They might get worse first. So it's important that you're out there, again, being proactive with your strategies as far as attracting and retaining that top talent. What I want to speak about are actually some of the actual trends that are happening right now in the healthcare field. And what I want to speak about first is the opportunity to offer flexibility when hiring, right? So what we're seeing now is the job seeker is expecting the organizations that they're interviewing for to offer them flexible options, such as maybe telemedicine, general flexibility in the field of hiring. Can you talk about that, Kenietha, and the flexibility expected by job seekers?
Sure. So we are a very transient population anymore, right? And social media, I feel like, has kicked this up even more when we talk about job seekers. They want something that is convenient for them. If you look at the difference in the generations that are entering the workforce now typically want that flexibility. And so we've had to adapt and flex to what methodologies are we proceeding with in the interview process and into the onboarding phase. So traditionally, I've worked with clients that have done 1 to 2 to 3 days in-person orientation, and that is no longer the case. One, you want to focus on keeping your staff safe. Sure. And so in order to create a safe environment with where we are, remote orientation process is critical. So how can you flex that to still make it engaging and interactive, but also covering the core regulatory things that needed to happen? And the same thing we did with a couple of clients that I've worked with. The onboarding process was a little bit of a challenge. Traditionally it's been, you got to come in and you got to see me for your pre-employment. So we've been able to leverage technology and virtual event platforms to capitalize on that pre-employment stage so that we could do more of it up front. In addition to just the interviews are great, and you can do team interviews in a technology based environment, but also those appointments and the follow-up afterwards. So it's critical that you think outside the box and utilizing those resources.
As a marketer, Kenietha, do you think promoting that ahead of time? So if I'm applying for a job and I know that onboarding is 3 days in person, or I know that it's virtually going to be done, do you think that weighs into my decision?
Absolutely it does. I think, anytime we can show that we are agile in our approach to our workforce, it's a huge bonus, and that's where we get wins in the healthcare space.
I heard you mention off before we started about the percentage of virtual positions or people working virtually and wanting to remain. What was that statistic?
Yeah, so the statistic, North Carolina language coming out there. When we went into the pandemic, right, we were able to be agile in a lot of cases, and we sent people home to work. So we flexed in some cases HR. I'll use HR as an example. It was the thought process that HR had to be on site for a lot of what we do. And then the pandemic hit and we put people at home. And the survey that was done showed that 97% of the workforce that got to go home and work remotely during the pandemic wanted to stay remotely. And so we have to be able to adjust to that to say it worked for this interim period of time. How do we make that sustainable?
When you say it worked, the productivity was there, the results were there.
Yeah, and a lot of times it was we saw a higher engagement in their productivity, right? Because they weren't having to have the commutes. In some of the remote areas that I partner with, you have people that are driving 45 minutes to an hour and a half to get to work one way. So instead of leaving their house at 6:30 to be at work by 8, they could jump on their computer from, the commute across their living room to get there. The other thing that we saw is that they were happier, healthier individuals. So they felt this sense of wholeness and appreciated as an individual. And then you didn't have all the water cooler discussions. You know what I'm talking about, right? The drive-by office visits that we see all the time in our world, because they could be engaged and they could be sitting there focused on their work. So productivity actually in a lot of cases for a lot of jobs went up.
So just to summarize this point before we move up, and we will open it for questions if you have any questions on this, but we're going to have a worksheet after the webinar for everyone that attends with these action items. So flexibility is huge. Keeping the staff safe with remote orientation and just having it as a benefit with remote orientation. And really just embracing overall a virtual agile approach is what we've been talking about. So.
Yeah.
Yeah, absolutely. And I think we really touched on too how remote and hybrid demand from the job seekers changed the healthcare hiring landscape. And I think we all know, and I think everyone on this call would agree, this wasn't just something that happened in a vacuum, right? What changed in 2020, what's continued to change through 2023 is going to be the new trend. We at Premier Virtual personally feel that the ability to be agile, both in hybrid capacity, offer more options to your job seekers, being inclusive as opposed to exclusive, are some of the most important things that you can do as an organization. So I appreciate your help there, Kenietha. Those are some great made. Next thing I want to get into is the branding of your company. I think everyone on this call would also agree it's important to stand out in a crowd, especially when hiring for healthcare. How does your group differentiate itself from hospital group A or clinic group B or urgent care group C, right? How do we attract that top talent within the healthcare sector? So I want to talk about that, some particular techniques that you can use to attract that top talent. So Kenietha, I want to get into that with you. How does your company, Churchstreeter and Crosse, I know you're just an HR firm, but how do you stand out in a crowd and helping to attract top talent for your clients?
Yeah, so a couple things. One, I think that you really have to focus on what is it that you want to sell your company as, right? You have to have a very strong branding and know that how you brand an organization to your patient population and how your recruitment brand appear are two very different approaches. And I think I have seen a lot of really intelligent marketing people, no offense, John, really intelligent marketing people say this is the brand strategy and it's a strategy geared towards patients. But really what you need to do from a TA perspective is say, okay, that's great. And everything that we do is patient centric. But what is our recruitment brand? How are we celebrating our employee benefits package and really celebrating the employee as a whole, right? It's not just about we offer X healthcare coverage. That's all great and good. But how do we really empower those individuals to be just that? How do we celebrate diversity and inclusion in our workforce? How do we tell the message of how we train and develop and grow our workforce and succession planning? And really being able to celebrate that from a branding perspective with recruitment marketing is so powerful. One of the most impactful strategies that I have seen around this is to not just constantly throw out, here's our jobs, here's our jobs, here's our jobs, and really telling a story. So employee testimonials are a huge, huge selling point for TA teams. Anytime that you can do virtual tours and things that tell a picture of what your organizational culture is and how it is a supportive and engaged environment, I think that sets your brand apart from the healthcare company that is just saying, hey, we have this RN position posted and this food service worker posted and come and apply here. It tells a different story.
So the days of just posting a job and everyone coming in and applying are not over. You mentioned one particular client, I believe that was in Green Bay, a little more remote area. And you spoke about not just the job, but the whole entire lifestyle built around that area. Can you talk a little more about that?
Yeah, so you know, when we come in as a consulting firm, one of the things that we really try to do is ingrain ourselves in your culture. And one of the things that this organization did very well was really focus on community engagement and involvement. And that's how they told their story. And because of that, their TA approach was very successful. So in a highly competitive area and some remote places, they were able to pull in top talent because they were continually telling a story of empowerment, individuality, uniqueness, and their investment in that in their community. So they were consistent in their storytelling.
I mean, and I could see that's a time commitment also from the employer, right? I mean, you have to allocate maybe a person or resources to be consistent. And so maybe some people don't have that in-house and can rely on an agency or someone like you to do that.
Yeah, absolutely. So we have professionals that is their focus, that's their passion. And that is one of the things that we try to do is when we hire people at Churchstreeter, we hire people that have been exactly where our clients have been, so they understand the frustrations. And we come in with an investment in your organization to really try to be successful. So
and that's your brand, right? That's the Churchstreeter brand, is how you're helping those organizations in that particular way, right? Because not every single firm like yours might have that same approach to, taking kind of a grassroots, more organic, almost an emotional way of looking at an organization, saying, hey, how can we help you? It's not just about the bottom line or the dollars and cents. So yeah, absolutely. I think the brand facing not only your candidates, but the brand, as you mentioned, for your recruiting efforts is ultra important. You have to have that proper brand to let people know. Part of standing out in the crowd is your culture, right? One of the main reasons I picked Premier Virtual to come work here was because of the company culture they have built around this organization. That's what drew me in. So I know, as someone who was once a job seeker, I know what's important to me as I'm looking for new positions. And in an ultra competitive field like healthcare, really important to have that standing out in the crowd factor. So yeah, appreciate that.
Just a real quick, when you share these stories, obviously your website, your social media, your press releases, everywhere there is a possible touch point. And I know it's controversial in a way, but TikTok, is that a channel, to also spread this branding voice?
I think it can be when it's done the right way, right? You have to have a very intentional approach. I have seen some healthcare agencies and organizations that have really good TikToks. And then I've seen some that have been like, wow, what a legal concern there. I would hate to be on their legal counsel, but
still quality control, and because each channel does have a slightly different voice, and I can see TikTok obviously having a slightly different audience, maybe a little younger, and the way that you present your videos can't be the same across every channel.
100% agree with that. That's accurate.
Those are great points.
Yeah, and we know TikTok is a hot button issue. If anyone's paying attention to the news the past couple of days or weeks, you've seen there's some federal government bannings of the TikTok platform. So that remains to be seen, but the other social media networks, traditional, I should say, like the LinkedIn, YouTubes, the Instagrams, those are still there for our use.
Mm-hmm.
Okay, cool. So I want to hop into the next point here, which I really think is the most important point on today's webinar, which is the idea of passive candidates. Now, some of you on this call may not be familiar with what a passive job candidate is. So think about an active job seeker, someone who is going to Indeed, they're searching for work, they're urgently looking for that new position, they're applying to jobs either in their field of interest or in their multiple fields of interest. Whereas that passive job candidate is someone who is maybe they're currently employed, but if the right opportunity comes up, they might jump on that opportunity. So what we want to talk about next is how to target those passive job seekers and really get those people into your tent of what you have to offer, even if they may not be looking for a new opportunity. So passive candidates in healthcare and how that can help your recruitment needs. So I want to talk about that a little bit. So Kenietha, can you talk about how maybe using some more out of the box thinking can help you attract those passive job candidates?
Yeah, of course. So I'm going to go back to that recruitment brand strategy, right? That is the first thing in really being successful with your passive candidates. But then, you know, a lot of people say, oh, well, we can just do job fairs. And you can just do job fairs, career events, right? But you're never going to be successful in building a passive candidate pipeline. So some of the things that I have seen, some of the strategies, think differently, like meet and greets. So people want to see where they're going to be working. They want to know. And healthcare now is so restricted in how many people are coming into facilities. So you can use virtual platforms to do meet and greets, and they can do virtual tours. You can do virtual meetings with the leaders, virtual meet and greets with HR. So a lot of the meet and greets. A couple of other things that I have seen. I had one client that we worked with, and they did resume building campaigns.
Nice.
And what they would do is they would do virtual events where people could drop in and meet one-on-one with a healthcare recruiter, and that recruiter would help them build their resume. That was twofold. One, it empowered that individual to be successful in their job search wherever they were going. But two, it allowed that healthcare client to be able to see from the beginning if that was a candidate that they wanted to start having conversations with. They were then able to capture that data and hold it in their pipeline source, so that as future opportunities arose, they already had that candidate's information, right? So they could reach back out. Another strategy that I have seen work really well is when you offer continuing education credits through your organization, and being able to show not only that you believe in training and development, but you're living that. You are training and development in action. And again, virtual event platforms are a good way to do that in addition to in person. So you can buddy those up and hit it from every angle so that you can get people, whether they're 10 miles down the road or 100 miles across the country.
Yeah, I know we're going to drill down even further with the training and certificates and education, but it's a huge point for the passive job seeker as well. But you mentioned on one of our other calls about the referral programs and word of mouth.
Yeah, so word of mouth is our best recruiting tool, right? Successful, and this is one of the I'm going to give you some of the Churchstreeter method here, so y'all are getting some of the secret to the sauce.
Okay.
Talent knows talent. And so if you have really high performers in your organization and they're willing to refer somebody, and they have some skin in the game to that person's success through that first year of employment, it is a win-win. It is a win for that candidate. It is a win for the organization and for the person that referred them. So a talent knows talent. I've just seen them called employee referral campaigns that is set up strategically. So I've seen it work well when it was done through metrics. So vacancy rates and turnover plays a point in that. I'm just curious, do you guys know what the average healthcare turnover is across the nation right now and why it's so important we build pipelines?
I would love to know.
I would love to educate us.
25.9% is the average turnover in healthcare. If you laser focus that down into RNs alone, RN turnover right now is averaging about 27% across the nation. Average time to fill for a lot of the positions in healthcare are averaging close to 50 days. And when you get into laser focus, like hard to fill positions, you're pushing 71 days. That's just to get somebody in the job. That's not considering the amount of time it takes to onboard them. So having that pipeline of passive candidates that may not be looking now, but as your brand gets out there and as they hear the story of the great things your organization is doing, when that opportunity becomes available, then that time to fill goes down for something that is critical to the success of your organization.
So retention, I mean,
it's huge. It goes hand in hand. A lot of people say we have a recruitment issue. We do have a recruitment issue, but we also have a retention issue. So when you talk about your branding for your recruitment efforts, it's also retention strategies too, right?
There must be a lot of layers in there.
That's right.
Yeah. One quick thing about referral programs, because I could throw it back at you as a recruiter, like you said, everyone kind of says that. Yeah, word of mouth and referral programs, but I'm sure there's the ones that work and then just saying, oh, if you refer somebody, you'll get $100. I don't know. Right. So do you also coach your clients through an effective referral program or what that looks like?
We do. We have a couple different tactics in our back pocket around referral campaigns, and a lot of it is dependent upon what are you trying to accomplish, right? That's always going to be the first question that we ask is, what problem are we trying to solve? And understanding the why behind it, because when we understand the why, and our what changes. So being very intentional about those referral campaigns, and an employee referral campaign that you do for a really hard to fill MLT, MT, RN position may be very different than a referral campaign that we do for something that is more entry level, because your audience is different. And so we work with you on what's going to not only be best for your TA approach, but also for your organization as a whole.
With that said, cost per hire in.
So cost per hire, it depends, right? But you're looking on the low end at 5,000. So I've seen it anywhere from $5,000 to $12,000 cost per hire.
So again,
do you know what the cost of that turnover is?
It exceeds.
It exceeds. You're looking at about $45,000 per person for cost of turnover.
Ooh, yeah, you don't have to say that. Someone to have a good retention.
Yeah, if you're losing 27 of every 100 that you hire, you're at, what is that, $1.2 million right there in turnover costs.
And I can see heads shaking across this call, all the healthcare professionals just going, oh my goodness, late to this.
Some of the pain, yeah, that we're
they feel it, they know it.
But yeah, so I mean, we just the referral program being very detailed, and also sparsing it out, if you will, depending on who you're looking for.
Yeah, because sorry, John, to interrupt. The strategy, just to touch on what Kenietha said, from that entry level person who's maybe a medical billing associate versus someone who's coming in as the director of a hospital group, that onboarding time, that cost per hire, everything's going to be different, right? Everything's going to be entirely different. So there's no uniformity there. So it's important that, again, to speak to an earlier point of the webinar, being agile and being proactive as opposed to being reactive and having the strategy set up for all the different positions.
Yeah, and if it's costing me $5,000 to $10,000 to hire somebody, if I give 1,000 to a talent in my organization that can refer someone in, I save a great deal of money and probably got maybe one of my best candidates.
Yeah.
So I'm just saying the value of that is clear.
Absolutely.
Absolutely. And you look at it, a lot of healthcare organizations are having to fill some of their vacancies with contract travelers, and those are extremely expensive. And that group of people, I'm sorry if there's anybody on, but they've really capitalized in the market because they're charging an exorbitant amount to get somebody in the door, because they know that healthcare organizations are desperate right now because we have to have staff to take care of our patients. And so if you can have a passive candidate pipeline ready to pull the trigger should that job come open, you're saving money, you're saving headaches, you're preventing burnout, because if that job's open for 71 days, how are you feeling it? You're feeling it with overtime of people that are already exhausted in the workforce. And that's hard. That's when you start to lose people and you see that turnover go up.
Okay, we have a couple questions that have come in. I want to tackle this one first. What is the best way to retain talent? So that's obviously a very broad question. We've discussed a few different strategies as far as the retention of talent, but I think that having a versatile strategy to retain your talent, having obviously the good company culture that we've mentioned, obviously you got to have the equivalent compensation and benefit packages. But what are some other ways that we can talk about retaining talent in healthcare, Kenietha, that we haven't touched on yet?
I think it is understanding why people are leaving. One of the things that I have seen is so many organizations say we got to do exit interviews, and they get really good data and they don't do anything with it, or they're getting the data when it's too late. And a lot of C-suite executive leaders say, what does the data show? And we should be a data-driven market. We should be making decisions with intent on that data, but we should not wait until it's too late. So I think probably we need to focus and shift gears. Exit interviews are still really important, so hear me say that, but I also think we need to be more intentional about doing onboarding surveys and understanding the technologies around that, and what do we do with that data. So 61% of new hires are looking for a new job within that first 91 days. So you're getting them there, you're getting them oriented. If you don't understand what success looks like to that individual, you're going to lose them. So I think a huge part of retention is not only giving the employees a voice, but acting on the data that's going to drive the impact. And what are your overall goals? What are you trying to achieve?
How often, I mean, I'm sure you've seen some of these data points, is just overworked and exhaustion, you know, and just overwhelmed that these people are, and they think that they could maybe go somewhere else where that might not be the case.
Absolutely. Absolutely. Yeah. More questions. Sorry, go ahead, Kenietha.
Yeah, I was going to say that's very accurate. Boomerang campaigns are a great way to do that too. People that leave that you touch base with in 6 months to say, how's it going?
Absolutely. Absolutely. Okay, we have a few more questions that have come in. Talked about the extensive time for hiring process, really an idea of how to speed up that hiring process. Just to touch on very briefly, I think offering different strategies for your hiring, maybe like including a virtual platform or a hybrid platform to allow you to have a versatile hiring strategy, right? You're hosting dedicated events around the positions that you have open, along with more passive, let's say virtual hiring rooms or virtual recruitment suites. So there's a couple of different ways that I think you can use to speed up that process. And I think, Kenietha, you would agree that having to think outside of the box, like you brought on Premier Virtual, that's you thinking differently, correct? Trying to speed up that process, decrease the time between 50 and 70 days, maybe it's like 20 or 30 days to get the person on board, right?
Yeah, I would agree with that. I would also say it is extremely important that you firm up that TA process and look at where you can eliminate waste. So a couple of the clients that we went into, what we were seeing is the candidate would apply. The TA team was so bogged down in the paperwork and the mundane, they weren't looking at applications for 20 days.
Oof.
Well, in this market, if you sit for 24 hours without touching that, you've already lost that candidate. So one of the things that we were able to do is we were able to come in and partner with them and deploy some strategies that took a 21-day, and healthcare industry standard is 3 to 5 days, right? That's where we're seeing a sweet spot. That same company who has over 500 openings, their TA team is touching every application within 24 hours.
Wow.
And
wow.
So they've seen a huge decrease in their time to fill as a result of some strategies that we've deployed.
Yeah, talk about giving yourself an advantage, right? That's differentiating yourself too. So that's really a good way to stand out in the crowd. Perfect. Thank you so much for that. Another question came in. You mentioned about workforce culture. What are some things you do for this? Is this something across the board for all types of companies? Well, yes and no. Is it uniform? I think company culture can be unique to each individual company, but I think it's more about, generally speaking, a positive environment, right? You want to be an uplifting, inclusive environment that really encourages your employees, maybe as opposed to more traditional disciplinary techniques. Maybe you're doing more incentivized techniques. I think it's going to be really unique though to each business. Our culture here within Premier Virtual, it's very easy going, but we also know what we have to get done and when we need to have it done by. So I think it's going to be different for each company. And I think Kenietha can probably speak to this for Churchstreeter. I'm sure they have a culture too that's excellent, but it's probably different than ours. So there's no playbook to put a culture into place. There's a couple different factors that go into it. And I think a lot of it we spoke on today, which is the brand of your company, your recruitment brand, your retention strategy. All of those things are going to affect your company culture and the perception of your company to job seekers.
Mm-hmm.
Okay, one more question here. Does Premier Virtual help set up events, and how long does that take? Great question. We do help set up your events, and an event setup is very brief. I can actually say that if you wanted to, we could have an event live by 3 p.m. and it is 2:32 p.m. Eastern Standard Time. Yeah, so great question there. We do help with setup of events, and we also pride ourselves on the time it takes to set up an event. Literally about 15 to 20 minutes once you become acclimated with the platform.
I think that's a good segue to basically the next section that we identified as a trend with virtual job fairs. You know, as a marketer, we get a lot of clients asking us, how do we get people to the events, right? So having the events is only as good as the people that show up. So do you have, Kenietha, some best practices, if you will, on not just setting up the event, but getting it out there in front of the right people to attend?
Yeah, I would say first and foremost, where I've seen really good success with virtual events is consistency. You can't do a one and done approach. right? You have to have, we encourage people to have a year plan on what that's going to look like. But know what you're trying to target and who you're trying to target, and then lean on people that are professionals in that. I don't have the marketing background, but I have teams of people that do have that. And so I lean on their expertise, and we make sure that whether it's for the Churchstreeter brand or for our clients brand, that we are in line with that brand culture and that brand strategy. So lean on the professionals when it comes to marketing your events. And then the other thing that I would say I've seen great success is to do like little save the dates, maybe a month ahead of time. But if you start marketing too far in advance, people forget about it. And so if you hit really hard closer to the event, I've seen more success in the ROI with that kind of marketing than I have 2 months in advance. Because by the time 2 months rolls around, I can't remember what I had for breakfast yesterday, much less what I signed up for 2 months ago.
If someone's cost to hire is 5 to 10,000 and the cost to lose someone is in the 40,000, how do you, maybe I'm going backwards into this question, but how do you say you're going to host a virtual hiring event and then not market?
Yeah, I don't know that you can. I think you have to. And one of the things that's really nice about a virtual platform is it's data driven, right? You get analytics that can help you show your ROI. And I know you guys already have some of that to help your customers. It tells a story. And when you take that to your CFO to say, the cost of turnover for one person is around $45,000. The cost to hire is an additional $6,000. We have the opportunity to have this platform, and we're going to be able to show ROI over time. So if we spend $5,000 to market 6 different events, so what at $30,000, we're still saving a ton of money for our organization.
Yes. It's a great way to.
And it's not just about necessarily that higher event. We talk about ROI. You mentioned it a few times. You have to think about too when you bring on a platform like ours. It's not just about the hiring events. It's about those orientations. It's about the onboarding processes. Whatever internal needs that you have, whatever you can envision hosting in person, you can do so virtually in a hybrid fashion of the platform. So I'm really glad that you mentioned that.
Yeah, we have a tool, video interviewing, where someone can actually just record their own video interview. And I would imagine for TAs, you could just go through these videos, and another great way to pre-screen. And so there's a lot of tools also with technology. I guess I'll just ask that real quick. I mean, how do you keep up with the technology? How do you recommend what maybe someone has already an ATS system? Do you guide them in a certain direction on maybe something that works better?
Sometimes we do that. So I think we just come in. A big part of our strategy is to listen, right? It's not my job to come in and say, you need to do this. It's my job to come in and try to understand what you're trying to do and guide you along the way. And if you have an ATS that works great for you, you have platforms that work great for you, then my job is to help you capitalize and maximize the potential of those. So technology is great when it works together and it does what we want, but it can become overwhelming at a time. At some point in time, it becomes too much to track, maintain, learn, especially if you're short-staffed in your HR departments, as I know a lot of healthcare HR departments are. So we try to meet the client where they are in regards to technology and say, here's our recommendation. But certainly if it's not something you want to take advantage of or doesn't work for you, then.
That's a great point. I mean, we integrate with ATS and, we have open APIs and all that, but we've tried to put a lot of into our own platform so that you can schedule it, right? You can schedule an interview right through the platform. You can actually track hires from events, so we try to make it so that it is one tool that solves a lot of.
Absolutely. And another thing I wanted to touch on too, you mentioned about be hiring, just so everyone knows in this call, and I'm sure everyone who is involved in the healthcare organization knows this, it's not just about hiring doctors and nurses, right? The top 3 most desired positions in healthcare that are open are medical billing specialists, medical administrative assistant, medical record specialist. These are not general practitioners, right? These are different positions that are kind of in the back, in the administrative side of things. So don't just think about doctors and nurses. When we're talking about hiring for healthcare and healthcare hiring trends, it's a broad spectrum approach. It's not just for those who are facing the patient.
Yeah, agreed.
Okay, perfect. So John, I think we have a question that came up for you. Do we help drive traffic to events?
We do, and it was something that we initially were not involved in as much as more of just a consultant. And now we are actually, like you said, Kenietha, partnering, with the pros. So we, depending on your need and depending on your target and depending also on your budget, we have a different partner that we can go to, from email marketing to just really smart AI powered, sophisticated digital campaigns that get in front of not just the active job seeker, but the passive job seeker. So we absolutely do. We sit with you. We do a free strategy call on marketing, and we're really proud of it, because I think it just separates us from just being just a platform, into someone who's vested in the success of your events.
Absolutely, absolutely. Thank you for that, John. Okay, and one other question came in. What other purposes can a premier virtual platform be used for other than hiring events? We just touched on that actually, so good timing. Obviously, resource events, benefit events. We have some workforce clients that use this for their unemployment services. Again, when you think about premier virtual, think about anything that you envision in the in-person world, any type of event. It can be hosted either virtually or in a hybrid capacity on our platform. So great question there. Appreciate that. Okay, next thing I want to get into is enticing the future generations to get into healthcare, right? So we're tackling the candidates right now, both the active and passive candidates, those who have their background in healthcare. They've already gone through, they've got education, in some circumstances, they already have experience. How are we enticing the future to get into healthcare? Because I know personally, looking at the last 3 years, if I was going to look into healthcare and I saw the stress that doctors and nurses run over the last 3 years, I might have second thoughts. So how are we enticing the future generations to get into healthcare? Kenietha, do you have anything to say about that?
Sure. So I do think this is a huge challenge, and it goes back to that gap over the coming years of 4.5 million people, right? That's a huge gap to try to fill. I have seen great success when we start to partner early with schools and developing internal programs. So I'm going to give you guys an example. We worked with a client a couple years back, and medical office assistants are pretty hard to find in the area that they were in. It's a remote location, not a lot of people coming into the area. And so what we did was we partnered with the community college and offered a certification program. We were able to do some interviewing on the front end and make sure that these people were going to be good fits for our organization. And we made sure we had something in place to pay for them to obtain this certification. One, that promotes them to grow. And two, they're going to have some long-term success in our organization, because now it's set a pathway for them. It shows that we are invested in them. Our first year that we did this with this particular organization, we had 12 people that we hired, put through the program. All 12 passed, were able to obtain their certification. And at the 1 year mark, 11 of those people were still employed with that healthcare system.
That's impressive.
Mm-hmm.
Is there an obligation once they get the certification to be with that employer?
Yeah, so that employer, I think it's dependent upon the program. They were looking at expanding it. Once they saw that model was going to work, they were doing some other programs with that. For the MA, it was an 18-month commitment. So at the end of that 18 months, they, out of the 12, they still had 10. And the only reason they had lost the 2, one relocated with the husband that got a job somewhere else, and the other had a child and decided to stay at home. But the other 10 were very engaged and were actually part of the high performers of the organization. And I want to say 3 or 4 of them had moved into lead MA roles. So they had continued to progress professionally in that 18-month period.
Yeah, I think the whole webinar leads to the funnel, right, of this, because there's always going to be a shortage, it seems. And healthcare is just so difficult. I give tons of kudos to anyone that's in the field. And so I think programs like this are going to have to be a big part of this.
Yeah, and just to touch on it too, when you talk about building partnerships within organizations in the community, that's also improving your brand, both parts of your brand, right? Your recruitment brand as well as your general brand for people that are looking at your organization and evaluating. If I know someone within my community has a partnership, I'm going to obviously be more inclined to go do business with that company, or maybe be inclined to work with that company. So I think that's a great tactic. That's thinking creatively. That's thinking outside of the box. That's standing out in the crowd. All the things that health organizations do to keep up with trends in 2023. Okay, so folks, We are almost to the end of our webinar here. Please type out your questions if you have any. We've already answered quite a few here in the chat. You can either raise your hand or put them in the Q&A section. John, was there anything else that you want to touch on?
No, I'd like to give it to Kenietha as if you gave this this audience one key kind of, and it's, I know that it's almost impossible, but something to start tomorrow, you know, to address a particular staffing shortage. Where would you maybe, you know, look at first?
I think first you need to be able to work with your executive team and understand what is the key challenge, and then develop your strategies from that. And I think most importantly, out of everything that we've talked about, is really focusing on building that recruitment brand. I cannot stress that enough, because that is almost the key starting point for all these other things to fall into place. So what is our recruitment strategy, our recruitment brand? What is that going to look like, and how do we go from there to expand it out into all these different arenas?
Also a commercial or an ad about the hospital, and then in the corner it says hiring now or something like that.
Yeah, yeah.
To the extent of the recruitment branding.
Yeah.
Well, I've had a blast learning about all this, you know, we hope the audience appreciates, you know, I mean, I know they do, the topics that we talked about. How can they get in touch with you, Kenietha, if somebody wants to, you know, just to have a strategy?
Yeah, well, Churchstreeter Crosse has a website. I'm happy for us to send my contact information out to all the people that attended, so that they have my direct email, my cell phone number. Happy to have conversations.
Yeah, we will include that in our follow-up. We will send a replay video of the webinar and also the worksheet with all the actionable items. Also, will include this contact information as well.
Yep, and that covers the question that just came through. Yes, we will be circulating the reporting way as soon as it's available to us. We will be circulating. So again, thank you all for joining us. Kenietha, Presnell, we really appreciate you and your time. You are a rock star. Thank you so much.
Yeah, thank you for your time. I appreciate it.
And okay, if anyone has any questions, please let us know. You'll have all of our contact information to circulate the webinar recording. We appreciate you all giving us your time. Thank you so much. Have a great rest of the Tuesday. Bye.